A Community Assessment of Athens, Georgia by Annika, Ashley, Cameron, Madison, and Stephanie.
A brief history of Athens. The University of Georgia, the nation's first land-grant institution, was chartered in 1785. This set aside land to develop a higher education in the area. In 1801, Clark County is enacted and named after Elijah Clark, who was instrumental in securing trade with the indigenous Native Americans in the area. In 1806, the city of Athens was incorporated. Athens was named in honor of the center of higher learning that had flourished in classical Greece. In 1991, Athens-Clarke County became one of two consolidated city-county governments in the state of Georgia. Today, Athens is a thriving melting pot of a community. Athens today. Athens is described as a college town with a rich history, vibrant and thriving downtown area consisting of numerous bars, restaurants, shops, theaters, and concert venues. It is roughly 122 square miles and the smallest land area of Georgia's 159 counties, but the 19th most populous county in the state. There's numerous outdoor spaces and more than 2,000 acres of space that is managed by the Athens-Clarke County Leisure Services. There's also the State Botanical Garden of Georgia, which is an outreach of UGA. In 2020, Athens was named one of the top 100 best places to live, number 32 nationally and number 1 in Georgia. Athens by the numbers. In 2019, the estimated population was 126,913. Of this number, 37,283 people are students, which equates to roughly 29.3% of the Athens population. 48% of the people are male and 52% are female. 29.9% of the total population is living in the poverty range. The median household income is $38,311 a year, and the current unemployment rate is 5.2%.
There are a number of social and environmental factors that affect the health of Athens citizens. For example, Athens has just about 16,000 acres of green space that are both on private and public property, and that totals to about 20.6% of the county's land. The county has over 2,000 acres of parks and recreational areas. Some of these include art centers, athletic fields, a lakefront beach, dog parks, paved and natural trails, playgrounds, pools, and the Bear Hollow Zoo, to name a few. Athens is also known for having a large nightlife scene, boasting 80 bars within a single square mile. And because it is so condensed, there are a noticeable number of trash bags piled along the streets of the downtown area, as well as loose trash throughout the sidewalks and gutters. Because it is a college town, there is a great deal of underage drinking, according to the Athens-Clarke County Police Department. Out of 2,919 arrests made over a period of 3 years, over 1,000 of those arrests were for underage drinking. The Athens-Clarke County Unified Government also has a number of projects in which the objective is to improve public safety. Some of these projects include police vehicle programs, public utilities, water enhancement extensions, correction center, food preparation facility, and other improvements, and environmental compliance and remediation. Athens also has a high level of poverty. The poverty rate of the city fluctuates between 38 to 40% of its residents, and half of those living in poverty in the city have incomes that are half the federal poverty level. The hospital emergency room is often their primary health provider, and they, in general, have less access to health care and are less likely to take part in any level of health prevention. Athens does have healthcare services spread throughout the city. The two main hospitals in Athens are at Piedmont Athens Regional Medical Center and St. Mary's Hospital. The University of Georgia also has its own health center where students can be seen.
The priority need we identified for our community, Athens-Clarke County, is the reduction of binge drinking among the college population. Athens-Clarke County is home of the football team, the Georgia Bulldogs. It is a very well-known football team across the nation. And it is common for college students to engage in drinking behaviors during the football season. They have college parties. They have tailgating festivities. And tailgating is not something that happens very often, so alcohol consumption is at an all-time high during this time. In addition to it being a university, this is where students get to experience free time away from parents. They don't have as much parental control to be under, so therefore they're experimenting, engaging with alcohol that at different parties that take place on campus or in the surrounding area. But it was also found that some students are coming to college as experienced drinkers, and this will allow for a higher alcohol tolerance for students, which researchers found there was an increase in blood alcohol concentration among the college students over a course of, I believe it was 3 years. And therefore, UGA students make up a large portion of Athens-Clarke County population. The UGA's 40,000 students makes up 1/3 of the county's population. So that's more than half of their population. The students without UGA, I've seen that Athens wouldn't thrive as much as it would with it. So we wanted to identify something that target the larger portion of the population, and I believe providing education to the students on not binge drinking or just not drinking at all will help with health promotion.
In order to reduce or eliminate binge drinking among the college population in Athens, Georgia, we are implementing the use of the Alcohol Use Disorders Identification Test, or AUDIT, for every patient that visits the University of Georgia Health Center. The estimated population of Athens is 126,913 people. Of that, around close to 40,000 are undergraduate and graduate students at the University of Georgia. Nearly 11,000 of its residents are employed by the university. Thus, nearly 40% of the population in Athens is affiliated with UGA in some way, student, faculty, or staff, and they have access to the health center. So the results from these surveys would represent close to half of the population of Athens. The test we have chosen to implement, the AUDIT, is an efficient, inexpensive screening for early-stage alcohol problems. It was developed at a World Health Organization collaborative project performed in the 80s, but it continues to be one of the most accurate alcohol screening tests available in terms of detecting hazardous or harmful drinking patterns. The audit contains 10 multiple-choice questions with regards to quantity and frequency of alcohol consumption, drinking behavior, and alcohol-related problems and reactions. The test is evaluated on a point system. Those who score more than 8 may have a problem with alcohol. If a patient scores 8 or more, they will be educated on the topic of binge drinking and directed to a healthcare professional who can better serve them. If a patient scores less than 8 but indicates that they are drinkers, they will be provided with an educational brochure about alcohol and its effects and warning signs of binge drinking behaviors.
The purpose of the evaluation is to determine how effective audit screening will help decrease and prevent binge drinking on campus. The audit test results and educational measures will be observed over time to possibly display a shift in the population risk of binge drinking. By analyzing the overall audit score data and providing education, the clinical staff will send out evaluation questionnaires to patients after 3 weeks from their initial visit via email. The questionnaire will consist of 4 questions, including what effects did the audit test have on the client, with examples of changes in knowledge, attitude, and behaviors. Did the audit test actions, services, and activities raise awareness of binge drinking and provided new and helpful knowledge to the client? Have the client noticed a decrease in their alcohol intake from their last visit, and should the audit test be continued or modified? Analysis of questionnaires will indicate knowledge and effectiveness of the program and their likelihood to modify their behaviors to reduce binge drinking. Accessing hospital records, traffic, fatality data, and crimes related to students who were intoxicated will determine and keep track of the effectiveness of identifying binge drinkers and how the audit test intervention is helping prevent and reduce binge drinking. A significant purpose of feedback is to help drinkers recognize discrepancies that exist between his or her current circumstances and develop personal goals and aspirations. It will also acknowledge the alcohol-related concerns in the community and compare individuals' drinking habits to actual campus norms.